But now to the main matter of this evening, Katherine Boydell. We're extremely pleased to have Katherine Boydell to talk to us tonight. She's the founder and director of the world's first multidisciplinary arts-based knowledge transition lab at the Black Dog Institute at the University of New South Wales. Her lab received the Tom Trowell Research and Evaluation Award from the Mental Health Service in 2024. She's a fellow of this Academy, of the Academy of Social Sciences, and she was the inaugural recipient of the Milner Interdisciplinary Prize from the Royal Society of New South Wales. So I'm really grateful that Katherine has agreed to talk to us this evening. Thank you.
Imagine this, just 2 hours a week, the time it takes to watch a movie or attend a dance class, can calm your spirits, your mind, and connect you to something bigger. Arts engagement isn't just a luxury, it's a lifeline. Listening to music, painting, dancing, or attending a performance. These aren't just hobbies, they're proven pathways to mental health and well-being. Prescribed creativity? Yes, it's real. When doctors prescribe arts programs, GP visits drop by 37%, and hospital admissions fall by 27%. For adults over 50, regular visits to cultural venues can reduce the risk of depression by 32% over a decade. And when we create together, singing in choirs, painting in groups, sharing stories, we don't just make art, we make community, we make mental health. And a growing evidence base shows arts engagement reduces anxiety and depression and supports trauma recovery. In this session, I'm going to tell you a little bit about our arts-based knowledge translation lab that I lead at Black Dog and share a high-level overview of the evidence for arts and health. I'd like to describe 3 studies, exemplars, that use the arts to address the mental health of young people. And before I get started, I'd just like to acknowledge the Bidjigal clan of the Darwell Nation, upon whose lands I'm joining you this evening. And I'd really also like to acknowledge the importance of lived experience throughout all of our research, which is really important to us from the very beginning. And I really wanted to start with a bit of a story. And it's all about the importance of arts in our lives and the importance of cultural activities. And this image here is a beautiful photo of the Amalfi Coast. And when I was in primary school, I was sent home from school one day and I was suffering with intense abdominal pain. And I was lying on the sofa in my parents' living room, and there was this beautiful oil painting of the Amalfi Coast. And I imagined myself in that picture, listening to the warm wind on my face and hearing the waves lap up against that rocky shore. And it really made a difference to my pain level. I was transformed and transfixed. And that memory really held with me and really highlighted to me the very first experience of thinking about the importance of arts in our lives. Now, as I mentioned earlier, I was recruited to the Black Dog from Toronto, Canada, where I worked at the University of Toronto. And it was really all about my work in knowledge translation and addressing this knowledge to practice gap. And I think it was really about, as an academic and as a scholar, recognizing that much of our research findings are published in journal publications and in books and presented at scientific presentations. But the problem is that they're not readily accessible by the people who need to know, the clinicians, the policymakers, health consumers, and the general public, who will say, you know, we can't access these publications. If we do, we don't have time to read them. We don't understand the language. So it was really all about thinking, how do we as academics share our research in ways that are much more accessible to the stakeholder audience who really need to know the findings of our research. So really my research in the Knowledge Translation Lab is focused on 3 key areas, really wanting to make our knowledge, our research findings more accessible to these populations. So it's all about generating knowledge. How do we create knowledge using art genres, performative, literary, visual? How do we involve our research participants in using these methods to depict a lived experience of a mental illness, to share their experiences of an intervention, or even a social context? And then we're also interested in, how do we share our research findings with these audience? How do we disseminate these findings in really digestible main messages, and also measure the impact of that. So does it make a difference depending on what our goals or objectives are? If it's to increase mental health literacy, if it's to decrease stigma, if it's to change practice or behavior. And then more recently, we focused on art engagement interventions. So how might engaging in arts as a program, as an intervention, impact depression or anxiety or trauma or suicide? So we've been really involved in focusing on those areas. So wanted to sort of stress that we work across the lifespan, as you can see in this diagram, from the very youngest right through to older adults. So we focus on a wide age span. In my talk this evening, I'm going to focus on young people primarily. But I think what I wanted to highlight is, in addition to those three key areas of knowledge, excuse me, creation, knowledge dissemination, and arts-based intervention, we're really interested in advancing the science in the theory and conceptual frameworks. As a sociologist, my work is really grounded in a commitment to advancing theory and method. And I'm particularly interested in developing innovative methodological approaches that are responsive to the complexity of lived experience, and really also focus on much participatory research, on interdisciplinary collaboration, and really pushing the boundaries in terms of how we conceptualize and investigate the social world. So as you might imagine, our work involves working not only with other scholars, but also with clinicians, with art curators, with artists, and with people with lived experience, which is really important. Now, I'd like to talk a little bit about the global evidence base. So what do we know about the evidence base around bringing the arts and science together? And I think what we've seen in the last 5 to 7 years is a real burgeoning of research on the arts and health, and what do we know about it. So there's been the report from Creative Health, where I responded a little bit earlier about those very powerful stats about reduction in GP visits and emergency room visits. There's been the World Health Organization report that synthesized over 3,000 studies from across the globe that really showed that creative pursuits, as I've mentioned, like painting or engaging in art viewing or singing or dancing, has a positive impact on our physical and mental health. And I think really importantly as well, can lessen social isolation and increase community and connection. And we know this is a huge issue more recently. I think post-pandemic, we've seen that social isolation has been a huge problem, and in particular for young people, which kind of goes against the grain of what we might think. I also wanted to kind of stress that it's not only the global evidence base, but it's more local reports that have really highlighted the arts and health. So there's been the recent New South Wales Health and the Arts Framework that again highlights the need to bring the arts and health together in hospitals, in clinics, in communities. There's been recent arts, creativity, and mental well-being policy documents that highlight some of the research in this space, and the more recent Revive document, again, highlighting. So these impacts support a whole of community approach. And I think what's really important is to focus on the social determinants of health and really bring mental health outside of the formal health system to incorporate more community-based programs and offerings. So you can see here that this is just a slide that synthesizes the evidence for the arts in terms of what it does for the economy and for the education and for the workforce, and really the more social impacts of the arts on the health of communities and the health on Australians more broadly. I also wanted to highlight this lovely little book, Thinking Thoughts, which is a compendium. It was one of the first projects that was brought together by the Arts and Health Network, where I've been very involved with this network of artists and clinicians and researchers trying to focus on how might we bring the arts and health together in the state. And this was really a project that was asking a wide, diverse group of people, from young people to older adults, about their experiences of their first personal experience that made them realize that art and culture had some impact on their life. And I shared my first experience on that Amalfi Coast painting. And we received over 100 responses, beautiful little briefs or poems about what made their lives changed or important about engaging with the arts. So this little book was funded by New South Wales Health, and it went to waiting rooms across the state, in hospitals and in clinics. So just something that in that sort of waiting room, often very anxiety-provoking room, there was a little booklet that people could take up and could receive these lovely thoughts from people about the importance of arts in their lives in terms of what they can be and what they've offered us. Now, as I mentioned, we're undergoing a real systems change about bringing the arts and health together. And I guess I just like to encourage us to think about a doctor's prescription that might read, take 2 museum visits and call me in the morning. Well, that might sound strange, but this isn't just a feel-good story. It's actually science, and it's been happening across the globe. I know in the Canadian context, GPs have been funded for this very thing, to offer up free museum visits to their clients. And this has been measured and shown that it's had a wonderful impact on their overall mental health and well-being and physical health and well-being. So this evening, I'd just like to share a little bit about how might the right dose of culture be just what the doctor ordered for our collective health and well-being, with a particular focus on young people. So I'd like to do this through 3 study exemplars of the work that we've been engaged in my lab. So the first one I'd like to share with you is Culture Dose for Kids. Now, we know that anxiety is a pervasive mental health issue that faces a significant proportion of young people worldwide. Research consistently indicates very high prevalence rates of anxiety, with estimates ranging from 50 to 20%. And recent studies have shown that these diagnoses have increased substantially within this population. And left untreated, we know that childhood anxiety can have far-reaching and long-lasting consequences. So this program, Culture Dose for Kids, was created with our Art Gallery of New South Wales partners, with young people and their parents. And it's comprised of 8 sessions that involve an hour of deep looking at 3 very carefully curated artworks, followed by a morning tea and an opportunity to create themselves in response to the artworks. And what's really important to note is that parents themselves also experienced a parallel program, viewing the same 3 artworks, but separately. And it was based on, the actual co-creation was based on the Australian longitudinal study on young people. And what we did was identify the key components or key factors that young people worried about, and we flipped them to the positive. So, for example, worry about climate change became immersion in nature, and worry about friendships became connecting with others. So each session focused on a particular theme, things that young people worried about, and again, flipped to the positive. So the actual program comprised 3 phases. It was generously funded by the JIB Foundation, and funded us for 3 years to focus on 9 to 12-year-olds with anxiety. So our first phase focused on a pilot in the Art Gallery of New South Wales. Our second phase focused on the deployment of the program in a number of regional art galleries. The third phase focused on young people creating their own digital stories of what it was like to be involved in this program. And then we created a toolkit for broader accessibility of the Arts Culture Dose for Kids program itself. So in terms of who participated and where, you can see that over 500 young people and their parents participated in the program. We had 22 programs that were delivered in 15 galleries across the state and almost 9,000 hours of intervention. We had satisfaction ratings of 9 to 10 out of 10, We had a strong program retention rate. And again, this is really high when you think about research programs that are over an 8-week period of time where we're expecting our research participant to actually get to a gallery every Saturday morning over 8 Saturdays. And to have this kind of ongoing participation was really, was quite unheard of. It was successfully implemented in 15 art galleries, and we engaged over 80 mental health and arts professionals. And again, I think in terms of capacity building, we had these particularly regional galleries and art facilitation facilitators engaging in this over a period of time. Was really wonderful to see. This is just to indicate kind of the reach of the program over the galleries, to see that as the project evolved, we found that the running costs decreased. As I mentioned earlier, there was really a capacity building program for these regional galleries, many of whom were able to continue the program after the research. So again, in terms of thinking about sustainability and building on these positive research findings was really important. So in terms of the outcome, we found significantly decreased anxiety in young people. We found improved social connectedness, so a real sense of community, so that when you think about these families and parents coming together, not knowing each other at all, but creating these very strong bonds through participation in the program that lasted following the program. I think what was really important was evidence of really deepened child care, parent bonds. So what parents told us was that they had enhanced connection with their young people, that they had something they could talk about throughout the week before they went to the next session, so that they could really talk about the engagement they had with these artworks, about how they each responded, creating their own particular artworks. They talked about their artwork sort of being up on the fridge and how that was fodder for discussion. And it really supported parent well-being. So parents had an opportunity to connect with each other and share their experiences, which was really important and also an unanticipated result of the program. What I put on this slide were just a little dose in a way of some of the parent comments about their own experience of the program and their observations of their child's mood. So again, really supporting some of the quant findings we found. So again, very positive comments about the program itself and wanting it to continue on. So now I'd like to move to the second exemplar that I'd like to share with you. And it's a project that involved, again, intergenerational. So again, I've focused on young families, children and their parents or carers, and really focusing on decades of evidence that demonstrate the benefits of time spent in nature for children's mental health and well-being, and really acknowledging the recent research that focuses on climate anxiety and children's mental health and the increasing worry about the multiple intersecting crises affecting places and planet, global warming, biodiversity loss, and natural disasters. And again, you can see this was one of the items or the things that kids worry about, and one of the focuses in Culture Dose of Kids of one of the sessions that focused on immersion in nature and kind of identifying that worry about climate change. And just wanted to highlight that in a recent global survey, over 80% of young people were worried about climate change, and 45% of these young people experience these worries daily, on a daily basis. So really wanted to acknowledge that these emotions can be a helpful place to kind of start building good mental health in the context of this environmental crisis. And so what we wanted to do was build on these kind of positive experiences to actually acknowledge these climate feelings and emotions. So this particular study was focused on body mapping and a body mapping nature program. So our team of researchers from our lab and a number of different universities, focused on exploring these ecological emotions with young families from the local government area of Randwick, but we expanded this to local areas in Queensland as well. So we had over 100 families who lined up to participate in this hands-on activity where we gently prompted our participants to think about their feelings in and about nature. And we found that some of the responses in this very informal setting, as you can see on this slide, it was a very lovely parkland setting, were startling. And we wanted to conduct formal research to understand more about the experience of children and the feasibility of using body mapping as a mode of engagement. So body mapping has a long history in community development and in health promotion, and more recently in our research program, to really share embodied lived experiences through mindful and reflective facilitation that enables our participants to think about their thoughts and feelings through a very facilitated scaffolding process. So in this particular project, we had people actually collect artifacts from the neighboring community. So you can see here that, talking about their experiences of being in nature, about their concerns about the environment, and actually using branches and rocks and flowers, and ask them to just consider everything from the placement of these artifacts to their mental imagery, and to share their body maps and their stories describing what it was like to make them, and then their experiences that they helped to articulate. So it was wonderful to collect these narratives and stories. And through their body maps, we were actually able to capture their complicated emotional relationships with nature. So on the one hand, they talked about their joy and relaxation and their awe and peace being in social spaces like the beach or the bush or the park. But on the other hand, they also worried about a range of threats. And they talked about deforestation and plastic pollution and coal mining and climate change. And so their collective and interconnected body maps and the range of natural materials, as you can see on these maps, help to convey this kind of porous relationship between people and place, and between positive and distressing emotions, which help shape our mental health overall. And in this way, I think the maps enabled new conversations between families. For example, one mother didn't know her 9-year-old son was aware of deforestation, let alone that he worried about the plight of orangutans in Borneo. And another boy, 7 years old, used bark and soil in his body map to reflect on the language of trees. So I think that these body maps helped offer new vocabularies for all of our participants in this project. So again, it was a really important public awareness project that actually has informed the development of programs and resources to support young people experiencing climate distress in our work. So I'd like to move now to study 3. And it's called Rebloom, which is a beautiful metaphor. And it's a study about how an art installation is changing conversations about self-harm. Now, young people often experience self-harm, and this project is part of our Black Dog Institute federally funded 5-year suicide prevention program, where researchers listen to the lived experiences of 27 young women who self-harm. And our lab took this research, worked over the course of a year with the researchers, with our knowledge translation team, with art curators, with people with lived experience, with a creative digital team, to really focus on the main messages of the research and the messages that young women wanted others to hear. So what emerged was a very clear message that support doesn't always need to come from formal interventions, that simple everyday gestures can be life-changing. Young women in the study told us that what mattered most were the small human signals, eye contact, presence, and listening without judgment. So what I want to show you here is a little glimpse of the Reed Bloom project, which I will show you in a moment, but you'll see that what we instructed the audience to do or to know is that if you step closer, the figure comes alive, her world begins to emerge, movements and presence shape her environment, light, color, sound, and her world responding to the subtle ways people interact. So it was intended to help people grasp in a way that you can feel in your body that the simple act of staying with someone can be profoundly supportive. So at its heart, Reboot reflects what lies at the center of so many health and mental health journeys: care, presence, and the quiet power of human connection. So the research showed that young women who self-harm most often first turn to family and friends, not professionals. So the message is that you don't need formal psychology training to help. Listen without judgment and responding with compassion can make a big difference. So I'm going to give you a little glimpse of this, this installation, which currently is in the Chatswood Westfield in North Sydney. It's been there for the month. And really the purpose was to invite all tenants and shoppers in this shopping center to engage with the installation, to chat with our research team and with the artists who are sort of hanging out, doing observations. There's a beautiful brochure with the main messages from the research that people can take away, and really enter in discussions about a very difficult topic. See that Reboot was an LED engaging, immersive installation, and it invites passers-by to engage, so that as people walk by or stop to watch, the installation shifts. So light patterns change, colors evolve, sounds respond. So the experience mirrors that quiet but powerful impact of human connection, something central to many mental health journeys. So you can see that Reed Bloom moves findings into public life, inspiring connection, and the hope is that we'll reduce stigma. So it's about moving research off the page and into the world, showing how art and technology can spark the kind of empathy that research alone cannot. And you can see in the previous short video that we workshopped the main messages and the findings, and in order to create Reed Bloom, really working with words and metaphors and exploring color and sound and seasons and movement. We had dancers and choreographers who attempted to embody the research in movement and created a score that was ready for motion capture. And really the final layer came from Zebra, one of Australia's most innovative immersive tech studios. And they conceived this interactive technology that transformed the choreography and the work into a responsive digital environment. Now we've taken, over the last 3 weeks, observational notes, which has been really interesting because what we've seen is young boys specifically have really engaged with the installation. They've been involved in breakdancing and moving alongside the woman, the figure in the installation. We've been able to engage and be able to talk about the research and some of the main findings. We have a QR code at the site which links to a survey where we're using a conceptual framework called the Think, Feel, Do framework, which corresponds with the cognitive, affective, and behavioral outcomes of the installation viewing. So we really are interested in, what do people think? Does it enhance their mental health literacy? What do they feel? Like, what's that visceral feeling from engaging? And then what might they intend to do and change in terms of behavior? So in terms of our findings so far, from the survey that people have completed. Here's just a bit of a screenshot of a word cloud in terms of what people thought. So you can see sort of they seem to feel that it was quite understood, that it was powerful. They really connected with that talking and reaching out. Some of the responses are the reminder that all we really need or want is connection, the power of physical interaction to evoke emotion and thought. It can be hidden in plain sight, that talking can help, that it can affect every type of person. In terms of what people felt, again, a word cloud, connection and joy and hope. Physical sensations were common, like goosebumps, butterflies, thrills. And then in terms of outcomes, what people intended to do, we got quotes like, it reminded me to look out for people. Another respondent, I particularly liked the message of staying with them. When you stepped away from the person, she stops and you feel guilty and you want to go back and be closer to her. Another participant said, talk about it, it's not taboo. So just in terms of some reflections, I think the 3 exemplars that I provided just provide a small glimpse into some of the work that we've done and how the involvement with the arts can help us to engage with and support young people. I think that here art surfaced and captured diverse experience to generate rich research data. It was used to share research knowledge to diverse audiences and significantly increased well-being of young people and their parents who engaged with it. The arts-based approaches enabled us to engage a broad spectrum of young people with different lived experiences, cultural and socioeconomic backgrounds, and mental health histories. I think that these exemplars demonstrate that the arts and creativity are engaging, acceptable, feasible, effective, and most importantly, enjoyable. As we've seen with the Culture Dose for Kids program, self-expression and creativity foster overall mental health and well-being, not only in young people with anxiety, but also their parents. The ECHO body mapping surfaced difficult to articulate experiences and supported safe sharing among young people, their caregivers, and their peers. And connections to self, others, and community are enriched as a result of participating in programs that focus on creative expression. And in the Rebloom exhibit, we see that we can engage a diverse audience in discussing difficult to talk about subjects such as self-harm. I think also engaging young people with the arts at the very start of the project development process helps us ensure it'll be relevant and safe for the cohort it seeks to service and support. In summary, our research has demonstrated that arts engagement offer young people a nonverbal creative outlet to explore and express complex emotions and provides a safe space for emotional release, reflection, and regulation, especially valuable for those who struggle to articulate their feelings through words. It helps young people explore their identities, values, and beliefs. It offers a sense of agency and self-worth, empowering young people to tell their stories and see themselves as creators. We've seen that arts engagement can be a powerful tool for inclusion, which I think is really important. And the good news is that it's being increasingly recognized by policy and decision makers, as witnessed in the rise of social prescription in Australia, and with the focus on exploring a framework for the arts and health that will take us into the future. Thank you.
Thank you very much, Katherine, for a most interesting and thought-provoking talk, which I'm sure has opened our eyes to the new therapies available for mental illness. And congratulations also on winning the Milner Interdisciplinary Award of the Society. I noticed that Jessica Milner-Davis, who's the donor of this prize, is in the audience this evening, and I hope she's enjoyed I think we've got a number of questions. I may start off with one. Can you just tell us some of the challenges you've faced in bringing arts-based approaches into healthcare or community settings? And in answering this, are there any difficulties in sort of generating the funding to pursue such avenues?
Yeah, fantastic question. Thank you very much. And yes, great honor to be the inaugural recipient. I'm very privileged and it's made it more meaningful because Jessica's had the opportunity to share some of the wonderful history of her family. So I feel very honored to be the recipient. So thank you so much for that. Yeah, absolutely fantastic question. I would have to say that it is challenging because I think with a lot of the healthcare funders, there's a way of knowing and a particular expectation around the type of health research that is expected. And when you kind of bring the arts or more innovative, creative methods into the mix, I think it's a bit of a harder sell. So often what we do is really highlight the rigor of the research because I think that's really important. Often I think there's kind of a thought that it's, you know, the nice to have, not the need to have, that the arts are a little fluffier. And I think what we always want to do is really ground it in very strong, rigorous research underpinnings in terms of selling the importance, in terms of impact. I think in more recent years, I think it's become a little bit more palatable, if you will, with the whole social prescribing and the sort of the focus on a very I guess, whole of person approach, so that when you're thinking about a specific healthcare issue or mental health issue, there's a recognition that we do need to look beyond the formal mental health and health system to other community resources that might help people in their daily lives. So for example, if you go to a mental health clinic because you're depressed, but you're depressed because your financial situation is out of hand, then no amount of psychotherapy or psychological treatment is going to help that issue, but it's what in the community could support that issue. Or if you're lonely, meds aren't going to help that issue, but it's that kind of social connectedness. So I think it's moving in the right direction, but it is a little challenging. I know that within the sort of the healthcare funding body, I think mental health itself, within the whole health realm, is kind of sometimes referred to as the orphan, doesn't get the share of the funds. So definitely is challenging. And I think it does relate to one of the other questions about, I think that I saw come through about the funding, national or state government funding to continue. Yes, we do have funding from New South Wales Health to do a lot of work with young people in schools using arts-based methods, particularly around climate distress and climate change. But I would say the lion's share of the funding seems to come from philanthropy or industry partners, which is wonderful because, again, it provides us with the funds to be able to engage in the work. And we are constantly putting our proposals into more formal healthcare funding bodies as well. But I think it's a little bit more difficult and challenging.
Indeed. There's a question from a new fellow, Chris Puplik. He writes, "Hi, Katherine. You may recall me as the chair of the Ministerial Task Force Partnering Arts to Health, which led to the New South Wales Health and Arts Framework, which you referenced. I'm wondering if you've reached out to the Australian Theatre for Young People, which has recently been funded by the New South Wales Department of Justice to take their work into juvenile justice centres and to address youth mental health problems in that environment."
Yes, thank you for that question, Chris. And I absolutely remember you from, I guess it's almost a decade ago now, from those task force days. So thank you for the question. And absolutely, we've worked with the ATYP group. I guess it was a couple of years ago. We worked with them and young people, and they together crafted a piece that was focused on suicide prevention, based on some research that we did together. It was a knowledge translation project, and they created a beautiful performative piece that was translated into a film. And that film has gone out to, I think they have a channel where they go into all kinds of schools to share main messages from young people around their experiences of suicide and self-harm. So it was great working with them and their group, and young people were involved in the research from the outset. So we're really involved in sharing their experiences and then co-creating this performative piece with the research underpinning. So absolutely, and it's wonderful to hear that they've been funded by the Department of Justice to continue on with the wonderful work that they're doing.
Catherine, there's a question from Jessica Milner Davis. Any ideas from the research results about timing issues? That is the length of participation and engagement and the length of impact of effect. Are you equally interested in individual and personal programs in intervention as in public offerings like the wonderful Chatswood exhibit that you reported on?
Yeah, thanks. Thanks, Jessica. I'm really delighted that you joined in this evening. Yeah, I mean, absolutely. The whole notion of the timing pieces, I think, is really significant. For example, with the Culture Dose for Kids program that involved the Art Gallery of New South Wales, because it was a research study, it was an 8-session program. However, at the end of the program, you've got these 20 families who want to continue on. They want to continue, and the research kind of ends. We've got our findings. And what happened is the art gallery actually used the findings of the study to advocate for continuing the program on in the gallery. So now it's a bona fide program at the gallery. And that group of families that was involved in the research have now become an alumni group that continue to interact with each other and with the gallery and with the program. So I guess for me, it sort of speaks to that temporal aspect of, when you're involved in a study and then it ends. And I think that's one of the challenges of being involved in this very embodied work where people are very involved in the research in a very different way than completing a survey or an interview, because they're very much creating and involved with each other and collaborative kind of work, that when the research ends, it's like a sad event. There's a loss and people want to continue together. So I think that's a really important ethical issue as well about being involved in research that is so participatory and so engaging. And how do we think about continuity, or how to deal with when the program ends, sort of after the sort of, it's almost like the movie when the credits are gone, then what happens, and that kind of thing. And yes, definitely equally interested in individual and personal programs, as well as that kind of public space as well. So it kind of runs, when I think about our projects, they run, everything from sort of the more personal, individual to group to more community, general public, large events where we're really trying to target that more general public. And a lot of it is around destigmatizing conversations about mental health issues that are often difficult to talk about, but to do it in a more community setting around the arts, which become another way, I think, to share experiences that where words often are woefully inadequate to express those kinds of feelings. And we found that it's sort of a more comfortable, safe venue to be able to have those conversations.
There's another question from Christabel. You may have alluded to the answer already, commenting it was great work. And do you have either national or state government funding to continue? I think you might have answered it, but anything more you'd like to elaborate?
I guess one thing is about the industry partnerships. So corporations, so corporates who are interested in the mental health and well-being of their tenants, of their staff, of their workforce, and are kind of seeing the recent burgeoning of evidence that engaging in the arts, whether it's as viewing arts in it or creating, has an impact on our mental health and well-being and sense of community and sense of social inclusion, and wanting to partner to have these kinds of programs and interventions in their, for example, shopping centers and office buildings and office building lobbies. And so thinking about ways that we can offer up this kind of work in terms of workshopping it and create a funding stream so that we can support our lab, actually. We have lots of research grants sort of under review at the moment. So fingers crossed that we'll get that national funding that we really need to continue the work. We have a global consortium of scholars using body mapping. So I'm really keen to, I guess, expand this work more internationally, because there's a huge group, particularly with in the global South, I think, which is traditionally been more invisible in terms of the work that's done there. So yeah, Hopefully we'll get that kind of funding that we want to continue our work, but it's always, it's always a challenge kind of going from grant to grant to grant.
It's a horrendous activity, isn't it? Look,
Yeah.
the work you've spoken of, it's mainly with children and young adults. And I was wondering, have you engaged adults in this style of therapy? And if so, what differences are there between the way children and adults respond to arts-based mental health programs?
Yeah, great question. Yeah, as I indicated on that one slide where I had the little 1-year-old who was engaging with the body maps, um, we really do cover the entire age span. So we've done a lot of work with older adults in aged care, where we've used different arts-based methods to identify brilliance in aged care. So what is sort of exemplary care? What does that look like? What are its constituents? And having people in aged care facilities use different art forms to express the kinds of care that they felt was exemplary as kind of a model. And what we did was we had people come to discuss their experiences of brilliant care or excellence or best practice in care. And we asked them to bring a found object or a material object to the interview. And it was amazing, the objects that they brought that kind of inspired this discussion about what care meant to them. And then we had one of our artists in residence took all these found objects and created this beautiful installation that then was installed in Westmead Hospital. So again, to kind of share findings with people who are caring for older adults, these are the things that are important. These are the components that really make a difference for these older adults. So yes, we cover kind of the entire age range. Very interested also in intergenerational. So having younger and older adults work together. But also to your question about the differences, I guess the one thing I would say with adults in compared to younger people, there's a bit more, slightly more reluctance, perhaps to sort of engage in the arts, because we always kind of create that safe space. We don't expect you to be an artist at all. It's kind of that freedom to use symbols or slogans or metaphors to express your experience. And I think with adults, it takes a little bit more time to warm up to that creative process. Whereas with younger people, I guess they're more used to doing that. It's just like, yeah, just right into it in terms of that drawing or painting or sculpture or creating digital stories and that sort of thing. So I guess that would be the main difference that comes to mind immediately.
In all the programs you've conducted, are there any reactions or outcomes from the participants that have genuinely surprised you?
I guess one of them was the impact on the parents of the young people in the Culture Dose for Kids program, because originally it was just focused on the kids with anxiety. And then we thought, well, these kids are 9 to 12 years old. They have to get to the gallery. How are they going to get to the gallery? We've got to involve the parents. So we thought, okay, we'll run a parallel program for the parents so that they're not with their children at the time, but they can also engage in the art, view the same artworks, and then we bring them together at the end. So we didn't anticipate that the impact on the parents would be even greater in terms of reduction in their anxiety. That wasn't really the focus of the study, but came up in our interviews with parents and our interactions with parents. So that was a surprise. I guess the other surprise to me would be a lot of the work that we've done around bringing people together and workshopping was done through the pandemic when we were in isolation. And so we had to quickly pivot and facilitate a lot of these workshops online. And I'll tell you, this was an ARC funded project, and we were really wanting to conduct it the way we had said we would. And we were really worried, how are we going to involve these women with intersection of disability, mental ill health, and refugee background, and engage them online in creating these body maps. And so the real surprise for us was that it not only worked, but these women created these amazing body maps and had the time between these workshops to work on these body maps. So I guess for us, it was advancing the body mapping worked, that it was not only feasible to do it online, but actually worked quite well and created a sense of community, even though it was online. So that was a bit of a surprise as well for us.
In designing these programs, do you co-design them with the participants and other actors, like artists and curators and participants with lived experience?
Absolutely. Absolutely. Goes without saying. We take a very integrated knowledge translation approach. So whoever our research participants are, they're involved right at the proposal writing stage. We involve them on the team. We hire and train them as research assistants. They assist with dissemination strategies. So they're involved every step of the way.
That's great. And look, I'll just ask one final question, if I may, before we wrap up. In programs like Culture Dose for Kids, what do you think contributed most to the success of the program? The creative activities, the social connections, or the reflective discussions?
Yeah, it's a great question. I guess what comes to mind immediately are the art facilitators. They are second to none at this process of slow looking. So if you can imagine 9 to 12-year-olds, and you've got 20 to 22 of them per session, they take them to 3 artworks over the course of an hour, and they are so skilled and talented at creating a beautiful space for talking about what they're seeing and just getting these young people engaged in talking about the artworks. What stands out to them? What does it remind them of? What does it call up? What colors do they see? They're so amazing, I can't tell you. And even the work with their parents, just that meditative process was amazing. So that was really profound for me. And then the morning tea, because the morning tea was just beautiful treats for these kids and their parents. And again, an opportunity for them to connect with each other. And that was just like a beautiful process. So it was just, yeah, it was a lovely process. And I do have to say, it was philanthropically funded by the Jib Foundation. The funders came to the final 8th session, met the kids and the parents, and as a result said to us, look, can you write us a proposal to scale this up in rural and remote communities for kids in these regions? So for us, of course we will. And so they funded us for another couple of years to be able to take it to those other 15 galleries. So that was just a real highlight of the whole process as well.
Thank you, Katherine, for a most thought-provoking conversation. I'll throw now to Christina Slade, who will deliver the formal vote of thanks and close the meeting. Thank you again.
Oh, my pleasure. Thank you.
And that has indeed been quite a passionate ride through the work that you've done. I've really enjoyed it enormously. I think we at the Royal Society, and we all understand that science and art are deeply interwoven. What I think is unusual is to have scientific evidence of the value of the art. So that's been a real, a marvelous reinforcement of what is, in fact, our basic thought in the Royal Society, that we need to bring together all of the sciences and arts of being human in order to think about how we can improve our society. I love the doctor's prescription, take 2 museum visits. I think I'll do that next time too. And I think what I thought was most fascinating was this issue around the being human and how important it is, being embodied. I found that really fascinating. We had the forum last week on AI, the hope and the hype, and we heard stories about, therapy, AI therapy, and AI carers for the aged, who in fact the aged said they liked better than the real people because they could be rude to them, which was quite a nice line. I think that this notion of being embodied and the role that it plays in what is going to be a different world, and the ways that art plays that art, are really exciting. Many, many years ago, and I think actually it's about 30 years ago, I was involved in doing philosophy for children in art galleries in New York and in Canberra. As you say, I think I've never had such exciting remarks about paintings we went into the gallery, sat them by the painting, then said, a Warhol's electric chair, which is pretty confronting. All sorts of questions about identity and so on. It's a very interesting space, but I suppose what I'm desperate to hear, and I'm feeling reassured by you, is that we can keep scaling and keep this process going. I fear it depends a lot on your own passion and work. So thank you very much. And I now turn to the audience and close this 1336th Ordinary General Meeting of the Royal Society. Thank you very much indeed.
Thank you.